I am going to do my best to avoid touching on a lot of the points that my partner made, although there were some good ones that he made that I will be reiterating just briefly. But I first wanted to further emphasize the idea of terminal illness and how it is defined, or how it isn't defined, and how ambiguous it is. Terminal illness can be taken multiple ways. Now, I think ideally terminal illness is defined as one's life is coming to an impending end, and assumedly it's within 6 months. Although there have been multiple cases, according to International Task Force.org, under their facts, the frequently asked questions, that have stated that patients have lived beyond the duration of 6 years very often. And this is because medical doctors often make mistakes in medical care. According to Jane St. Clair in Logical Reasons Against Physician-Assisted Suicide, in July 2009, Mississippi Supreme Court upheld a $4 million award to a family of a woman who was given a lethal dose of painkillers in hospice because she was told she had cancer and she was in the final stages and she was dying. However, an autopsy that was conducted after her death showed that she did not have any cancer cells in her body. And there are other examples. Now, this may not happen that frequently, but I will say that, sorry, I got work. Okay, sorry about that. But a report from the Journal of the American Medical Association, volume 284, said that the third leading cause of death in the U.S. 2 years ago was medical mistakes, or medical mishaps, and there were 2,000 deaths, unnecessary deaths by surgery, 7,000 medical errors, which could be categorized as misdiagnoses, etc. 20,000 hospital errors and 80,000 infections in hospitals. So doctors aren't perfect, and imagine being told that a family member was going to die and having them opt to induce euthanasia and then finding out only afterwards that it turns out they weren't even sick. So, along those lines, in the value of life, I just want to ask you guys what my opponent pointed out earlier, in that there are instances, very few instances, but instances when terminally ill patients do recover. 4.8, he said. So 4.8 instances, in 4.8 instances, people have recovered. So say that your mother was one of those 5 people, or excuse me, one of those 5 of 100 people that recovered. Would you say that her life wasn't worth saving? Would you say that 5 out of 100 people aren't worth going after if an airplane crashes and 95 people die? You say that, screw the other 5 people, they're not worth it. I think that that's a pretty significant offering or indication that every life is valuable, and in fact, if there is even any possibility of any sort of fault in anyone being put to death or inducing death upon themselves when there's a mistake, that it's not even worth risking that, and therefore euthanasia should not be legalized, because that is way too much of a risk for us to take. Thank you.